at least 5 times in 1 year. And the problem is so serious, and we rarely talk about it. The suicide incidence is 5 times higher than with any other addiction. So we have developed some materials and we have a workshop about raising awareness about gambling and about a very simple tool that allows to do self-assessment or for different organizations to assess other individuals about the risk and refer them to services and resources. So these are the things that we have, and all of them are different approaches to deal with community violence from the mental health perspective. We also like to partner with different organizations if they are interested. We have one of our clinicians has been trained in a model widely used in the US, which is called the Circles of Security. This is an 8-week program in which parents come, they are the clients, the adults, but what they do is, in order to learn how to develop better attachment with their children, what they do is they revisit their own stories and their own attachment history. So it is an indirect way for these adults to heal their own attachment issues from the past. So it is a dual purpose. So when there is an organization with a group of people who might be interested, they can contact us, and then we can facilitate the workshop. And we also are open if a particular organization is or community is interested in a specific topic that we may have expertise on, of course, related to mental health. We are very willing to partner with those organizations. And the best of all this is that we can offer this either in English or Spanish, and we can do this for free. And it can be done in person or online. The issue, unfortunately, is that most of the experiential pieces cannot be done online, but at least the workshops can. So these are pretty much the things we have. And I don't know if Daniela or Jessica could please put there like your email or your phone number so that people can reach out if you have any interest, or if you, of course, right now, if someone has questions, we can answer them. But if later on you come up with something that you want to learn more about or to meet via Zoom or something, please reach out and we gladly would meet with you. So I think, I don't know if Daniela or Jessica, if you ladies have anything else to add.
I think you covered everything Mauri said.
Okay, great. So thank you, Jessica. So Jessica has put on the chat her email address in case you have any further questions. And we also sent to Luvia a list of some of the workshops or the things we are offering in case there is some interest. I don't know if anyone has any questions or comments.
I have a question. Sorry, let me fix my camera. Thanks for coming out, by the way. The all these workshops that you offer sound really awesome. So my name is Aiden, go by he, him. I'm with NEIU, Northeastern Illinois University, and I coordinate the health programs. And based on what you were describing, a lot of these sound really awesome for the students. So I wanted to ask specifically about the dance therapy, if that's correct. Can you tell me a little bit more about what it is? Is it intended to kind of help students or people, I guess, in general, with kind of coping with the traumas that, like racial trauma, family trauma, that type of thing, what the activity looks like? I'm thinking to maybe do some type of physical activity, possibly. I'll reach out to talk some more, but I just was curious about how those physical activity programs work.
Yes, different. Going back, and thank you for the question, Iron. The as I said, the way in which or the way in which most of the authors now understand trauma is like something which is trapped in the body. It's emotional, but it is in the body. So in that sense, we continue thinking that talk therapy is very important to process. But at the same time, it's like we need to shake up what is inside. And all the physical activities are oriented toward like enhancing the channels to communicate or to open up those spaces in which the traumatic memories are trapped. However, because this is a one-time intervention, it does not replace the therapeutic process. So what we usually do is we pair the experiential activity with the presentation. So with the presentation, we provide the framework, and within that framework, then people can get a taste of connecting, reconnecting with their bodies. Because one of the things which is very common when there is trauma is that people may experience discomfort with their own bodies, or they don't even touch their bodies, or they experience the body in a negative way, like through panic attacks or some other kind of things. So we offer different physical activities. One thing that we offer is yoga. Another one that, but it is not the traditional yoga, more complicated with doing the pose, this or that. We use more what has been developed in the last like 10 years, I would say, in which some particular poses are more associated with anxiety, depression, with that kind of things, to mobilize those kind of things. So that is what the yoga part is. The other activity we have is isometrics. In isometrics, people are using the weight of their own bodies in order to gain strength. That is particularly useful for people who may have a lot of anger inside and don't know how to express that kind of things. Because they are doing the exercise, but they don't need to move actively. But there is internal or the muscles are moving in some ways. Another form that we use is dance therapy, and that is very much inspired by the Gestalt movement, which originated in Germany and emphasizes very much the body-mind connection. And it is also the basis of the third wave of the cognitive behavioral, this imagination and all that kind of things. So we pair the presentation. Usually the presentation is like 45 minutes. Then we have like a 15-minute break. And then we have like a physical activity for 1 hour. So the whole thing is usually 2 hours. Did I answer what you wanted or not really?
Yes, that was very good. Thank you.
Okay, thank you.
Great, thank you, Mauricio. Any other questions? I see that you put, was it Jessica? Jessica put her, yes. Put her contact information, her email in the chat in case you're interested or have more questions or want to pass the information to somebody else. Please feel free to do so. And thank you again, Mauricio. Thanks again to Jessica. Thanks again to Daniela. I know you're on as well. Thank you so much for making time for this meeting and to present to us.
Thank you for the invitation. Have
Absolutely.
a wonderful rest of your meeting. Take care.
Thank
Bye-bye,
you.
everyone.
Thanks. Take
Bye.
care.
Bye.
Okay, great. Moving right along, I'm going to pass the mic over to Danielle Wells. I'm sorry, I'm just reading 3 things at once. She's the manager of community health and well-being out of Loyola Medicine. Take it away.
Thank you, Lubia, and good evening, everybody. Once again, I'm going to go ahead and share my screen. Just sharing my screen. I think it was up. My apologies. All right, so I think everybody can see my screen now. Hi, good evening, everybody. I'm Danielle Wells, and I am the manager for community health and well-being at Loyola Medicine. And I'm going to be talking about some of our services we offer. All are free and offered at Loyola Medicine through our department. So first of all, I left a little bio, and Lubia, I can send you my slides afterwards to share out. But basically, I've been at Loyola Medicine since October of 2020. I started off as the coordinator for our diabetes prevention program, which I will be talking about the majority of this presentation. And I also I shared a little bit about my educational background. And now I have been promoted to the community health and well-being manager as of April of this year. So still pretty new in this role, but I'm excited to share more about what we all do. Thank you. So just in Trinity Health fashion, which Loyola Medicine is part of Trinity Health, we always start our presentations off with a quick reflection just to center us on what we're going to be discussing. So this one is from Mother Teresa, and it says, I can do things you cannot. You can do things I cannot. Together we can do great things. And I think that speaks to the benefit, the need for collaborative efforts throughout our area, throughout our state, so that we can get the job done and help our communities. So Loyola Medicine is made up of 3 hospitals, including Loyola University Medical Center, which is in Maywood, Illinois, Gottlieb Memorial Hospital in Melrose Park, and also McNeil Hospital in Berwyn, Illinois, which is where I am currently and where my office is. So I spend a lot of my time at Loyola McNeil, and it is a regional academic health system based in the Chicago West suburban area, as I just talked about. And as a reminder, it is a member of Trinity Health, one of the largest Catholic health systems. So I can progress to the next slide. When I said earlier, I'm the manager of community health and well-being, it's what is that? Here at Trinity Health, community health and well-being's goal is to promote optimal health for the poor and the most at-risk, underserved populations and communities by connecting our communities with social and clinical care and addressing the social determinants of health. We understand health to be to mean more than just free from illness. Health is the opportunity for education, for employment, having enough food on the table, feeling safe in your neighborhood, and ultimately thriving in the human spirit. And that's what we promote in our department at Loyola Medicine and across Trinity Health. So just some things we plan to cover today. I know I'm limited on time, but I'll make sure I stick to 20 minutes. I want to share more, of course, about our National Diabetes Prevention Program, which is a free service offered at Loyola Medicine. I'm going to talk about the enrollment process and how to refer and how to get the word out about the program that we offer. I will also briefly touch on our Courage to Quit program, which is our smoking cessation course offered through a partnership. And then I'll talk, lastly, I'll talk about the Community Resource Directory powered through Find Help, so that we can continue to connect the communities that we serve with resources that they might need. Last but not least, I always put have fun, because these opportunities are really fun to where I can share more about what Loyola does and also get to know more about what other organizations are doing in the community. So just a little background, just to jump right into the diabetes prevention program. First, it might be helpful to understand why this program even exists. Well, 1 in 3 people, adults specifically, are pre-diabetic or have pre-diabetes, and 9 times out of 10 they don't know it. And that's just speaking for adults. We know children, those who are under the age of 18, also have an increased risk of developing type 2 diabetes, or an increased rate of developing type 2 diabetes due to a pre-diabetes diagnosis. And just for some more data, and then we'll jump right into what the program is. There are 30+ million people living with diabetes in the USA. And here in Illinois, 11.3% of the population as of 2019 were told by their doctor they have type 2 diabetes. And it is also important to know that a lot of people don't even know they're diabetic, let alone pre-diabetic, which is really dangerous when you think about some of the complications associated with uncontrolled diabetes. The fact is, if you don't know you have it, you are less likely to control it or to take the steps to control it. So it can become a huge risk to your life due to those complications. And I already talked about the pre-diabetes prevalence in our state, in our country. 1 in 3 is a huge number, and that number can be impacted by the National Diabetes Prevention Program that we offer. Just some more background on diabetes. Diabetes is when your body cannot properly use the insulin that it naturally creates, and that creates a problem with high blood sugar, which most of us might have heard of, or we might know somebody who has been diagnosed with type 2 diabetes. It never fails. When I do a presentation in the community, everyone knows someone with diabetes if they don't have diabetes themselves. We know diabetes can have a lot of serious health complications, such as blindness, failure of the renal system, heart disease, stroke, and also it can increase your risk for amputations. And we don't want that to happen. Type 2 diabetes, what are the risk factors? I think it is very important to know the risks so that people can know where they fall and what they can actually impact. So age can be a risk factor where 45-year-olds or older have a higher prevalence of developing of type 2 diabetes diagnosis. We also know people who are not as physically active or don't get enough movement can have an increased risk of developing type 2 diabetes and also other chronic health conditions. If they're overweight, if they have family history of developing, if they have family history of type 2 diabetes, such as having a parent or a sibling with the diagnosis. And we also see an increased risk with women who are diagnosed with gestational diabetes during their pregnancy. There's also a risk associated with ethnic and racial minorities, where minorities, African Americans, Latinos, Pacific Islanders, Native Americans, so on and so forth, have an increased risk of developing type 2 diabetes. There are also certain health behaviors that increase our risk for developing type 2 diabetes, such as having a poor diet that has elevated processed foods in it, and then also smoking or using tobacco products. So when we're out in the community, when we're talking to people and providing education, we like to say to people, what of these risk factors can you control? We know age, we can't control our age, we're all getting older. We can't really control our family history, but can we get more active? Can we lose weight? Can we get a better diet? Can we quit smoking? Those are the type of things we want to impact with the National Diabetes Prevention Program. So in the National Diabetes Prevention Program, we have a key focus on pre-diabetes. So that pre-diabetes or before diabetes is when your blood sugar is higher than normal, but it's not at the level of type 2 diabetes, of a type 2 diabetes diagnosis. But it is a warning sign. We know that pre-diabetes can increase your risk for developing type 2 diabetes in a very short time. It can also increase your risk of heart disease as well as stroke.
Hello.
Hi. We also know that pre-diabetes is preventable. So that's where the education for the Diabetes Prevention Program comes in. So let's get into it, the National Diabetes Prevention Program. So we talked about some of the background on why the program is necessary, or what the risk factors are at this very moment in time. What are we doing about it? So in general, lowering your risk for diabetes can include getting a healthier diet, being more active and losing weight. Also knowing your numbers, so going to the doctor and getting tested for diabetes, especially if you have those risk factors, is a great step. But then you can get the support of a program that can help you make those lifestyle changes, because we know sometimes it's difficult to do it by yourself. So here at Loyola Medicine, we brand our National Diabetes Prevention Program as Fresh Start. So from here on now, I might call it Fresh Start. So Fresh Start is a healthy lifestyle change class, and it is powered by the Centers of Disease Control and Prevention, and it focuses on evidence-based strategies that helps participants lower their risk for type 2 diabetes if they're at risk. So this program is focused on preventing or delaying the onset of type 2 diabetes in those at risk. There is a focus on weight loss through getting more active or exercise, improving eating habits, and ultimately behavior changes that can help folks lower their risk for type 2 diabetes. The program is 1 year long, and throughout the program, there are 26 sessions. The program is broken into 2 phases, where the first 6 months, the participants meet with the lifestyle coach, and the group size is about 15 participants to 1 lifestyle coach. And they meet for 16 weeks, 16 consecutive weeks through the first 6 months, where they review core topics such as what makes up a healthy plate, weight management, getting more active, what's considered physical activity, stress management, and so on and so forth. And then in the follow-up phase, or the second phase of the program, we focus on maintenance. So by that time, participants may have met their goals that they set at the beginning of the program, and they work with a lifestyle coach to, as I said, maintain those goals and set new ones so that they can ultimately take these changes, keep them for a lifetime so that they will lower their risk for developing type 2 diabetes. Some of the expected outcomes of the diabetes prevention program is to help people who are at risk for developing type 2 diabetes lower their weight by 5 to 7%, increase their activity minutes to 150 minutes per week, lower their A1C, which is the test that's used to determine diabetes, and then set goals and action plan. So here I have some pictures from our participants. In the program, we had a group on the south side of Chicago, and then one of our participants sent over her plate of what a balanced meal looks like for her. So those are some things we include in the program. And just for some outcomes locally at the Loyola Medicine's Fresh Start Diabetes Prevention Program, since 2019, we've had 128 participants enrolled. In total, there were 584 pounds lost and counting. On average, participants were able to increase their physical activity minutes to about 179 minutes per week. It dropped a little bit throughout the second phase of the program, but ultimately, people were still able to meet their goals. I wanted to include that most of our referrals do come from our physicians or from other healthcare providers like a dietitian, a nurse, MA, or a referral coordinator at Loyola Medicine. We also do receive community referrals from organizations and also people self-referring to the program. I also wanted to add that most of our participants enrolled in the program based on having pre-diabetes, while others enrolled based on risk. And we'll talk about that a little bit in the next couple slides. So just to get an idea of what's covered in the program, I added a few slides. So we do discuss getting more active or getting more movement. There's also a huge component of the program that focuses on healthy eating, selecting healthier foods, and shopping at the grocery store and selecting healthier items there. There's also components on getting social support throughout the program. Weight management is a key component in the program as well, where at the beginning of the session, day 1, our participants set a weight loss goal, a moderate weight loss goal of 5 to 7% weight reduction. We also discuss dealing with stress and coping with triggers. And in addition to that, we focus heavily on tracking and monitoring one's progress. So whether they're eating or getting more active, weight loss, we have them track and monitor it on program provided logs or in notebooks or on different applications that they have on their cell phones that they're familiar with. Other topics beyond that include discussing the diabetic plate method and balance. We talk about processed foods and what that means. We also discuss sleep and its impact on your overall health as a topic. And then we also talk about planning. So planning your meals, planning your week, your goals, your SMART goals, planning activity, and so on and so forth. And then also, we also discuss heart health throughout the program because we know that heart health is really important in regards to overall wellness. So just for some eligibility criteria. So there are, this program wouldn't be for everyone, but we do have criteria that participants would have to meet in order to be enrolled. So this program is for adults 18 or older. They have to be at least overweight according to the CDC weight chart. They can't be diagnosed with type 1 or type 2 diabetes, and they can't be currently pregnant. And then the other criteria at the bottom shows that participants have to at least be diagnosed with prediabetes or have the history of gestational diabetes or score a 5 or higher on our risk assessment. So we see here that the top row here is, those are our non-negotiables. They have to meet the top criteria. And then for this bottom row, they have to meet at least one of the criteria. And I, when I said risk test earlier, this is the risk assessment that we utilize when we're screening participants for the program. We use it in the community to raise awareness about risk for prediabetes as well. And I'll be sure to share this as well as a link to the CDC risk assessment. And this is available in Spanish as well. All of the materials are available in Spanish. So once a person finds out they're eligible for the program, or if you're screening someone in the community or screening yourself for eligibility, and you find out you're eligible through the risk assessment or through a previous prediabetes diagnosis, then you can visit our website. And now I included the links in the presentation where you can read more about the program. And at the bottom, you can sign up, fill out a quick fillable form and submit it, and the email goes directly to me, and then I follow up that way. At the moment, we do refer our Spanish-speaking patients and participants to our partner organization, our sister hospital, in South Bend, Indiana, where they offer the Spanish classes virtually. But we are in the process of hiring community health workers at Loyola Medicine who are bilingual and who can deliver the diabetes prevention program, hopefully in person. That is the goal. So I did include the contact information for the program. I'm the current contact for the diabetes prevention program, so all referrals do currently go through me. I also included our program flyer on this slide, as well as a link to our landing page on the Loyola Medicine website. So that's the diabetes prevention program. And then I wanted to touch on some of our other services that we offer in our department. And I'm going to briefly discuss these. So we also partner with St. Joseph Health System in South Bend, Indiana, to offer Courage to Quit program, which is tobacco cessation group support led by one of the cessation facilitators over at St. Joe's. So the program is about 6 weeks, and they cover different topics around quitting smoking and getting support and coping mechanisms for tobacco use. And then I included the dates that those classes are offered. Those are virtual, of course, so we can refer patients or community members to that program. And then last but not least, I wanted to touch on our community resource directory. So I don't know if anyone on the call has heard of Find Help or the Hub or any other directory where you can search for community resources. Here at Trinity Health, Loyola Medicine, we brand our community resource directory as the community resource directory, where we have a platform where community members, our community health workers, our doctors can search for social needs through this website and connect patients that way. The social needs, the social services are found according to the person's zip code so that they can find resources that are local to them. And I did include that on our community resource directory website. You can select your preferred language so that you can find resources in your language, in your client's language, and then the whole website was changed into that preferred language. So here, these are some of the resources that you can find on the directory, whether it's food, help with finding food pantries, housing assistance, financial assistance, finding goods like car seats and supplies such as first aid kits, PPE, finding transportation, health, so on and so forth. All of those things can be found on the directory. So I just added a link or a screenshot to show you an example where you can see that our diabetes prevention program is also listed on the directory because it does address, again, a social need in the community. And I did see a question pop up in the chat. I did include a link to the directory, but I'll make sure I send that out to Lubia in an email too. And last, we do share these cards in our community as well, where we hand them out in the community events, and we have them in our ambulatory sites, our doctor's offices, where a patient can take this card and scan the QR code, and then again, change it according to their language so that they can find resources right in their zip code. And on the flip side of this community resource directory card, there's also information about prediabetes. So that's that collaboration with those services. So that's all that I have for now. Of course, I can go on and on, but I do appreciate this opportunity. IPHI, community ambassadors, and everyone on the call. Again, if you have any questions, you can reach out to me. And thank you all so much for your time.
Thanks so much, Danielle. I do have a quick edit. We're IDPH, so we're Illinois Department of Public Health. IPHI is a different entity, but that's okay.
I'll take that out.
Thank you so much. And just for the sake of time, if you have any questions, again, please feel free to email Danielle. She put her contact information. I will also include her contact information in my post-meeting email. And then in general, if anybody has questions, please feel free to reach out to me and I can connect you with Danielle. Thanks again. All right, moving right along to our next presenter, which is our colleague, Tom Broom. Tom is our infection control coordinator out of our medical services division. And Tom, I know I got that wrong and I apologize, but I will pass the mic over to you. Thanks so much.
Thanks so much, Lubia. Give me just 1 second and I'll share my screen. All right. Can everybody see?
Yep, we can see.
Wonderful. All right. So last time I was lucky enough to present to the community ambassador meeting. We got a question about long COVID. And so Lubia asked me if I would come back and kind of present a little bit more about long COVID, especially with information and resources. In addition, as Lubia said, I'm Tom Broom. I'm IDPH Infection Control Coordinator in the Department of Medical Services. So I wanted to start with what long COVID is. So when we're talking about long COVID in medical terms, there are two that commonly come up: post-COVID conditions, which is abbreviated to PCC, or post-acute sequelae of SARS-CoV-2 infection, which is abbreviated to PASC. And you can think the term sequelae is basically it's a complication or a bad consequence. There are a lot of other names that post-COVID conditions go by, including long-haul COVID and post-acute COVID-19, long-term effects of COVID-19, and chronic COVID. So I'm going to use post-COVID conditions when referring to long COVID. I think that it's kind of the easiest. And then the definition itself is signs, symptoms, or conditions that continue or develop after an initial COVID-19 infection. And these can last for weeks or months or even years. So there are a number of risk factors that make certain people more likely to develop post-COVID conditions than others. So it is more common in people who develop severe COVID-19 infection. And the definition of severe includes people who required hospitalization or intensive care treatment or were on a ventilator. In addition, people who were unvaccinated when they contracted COVID-19 may also be at higher risk, as well as anyone, however, anyone who has COVID-19 can develop post-COVID conditions. And this even includes people who were asymptomatic or didn't realize that they had COVID. Right now, post-COVID conditions, they're fairly new. Obviously, they kind of showed up a little while after the pandemic. And so at this time, the CDC is working with their partners to better understand post-COVID conditions, including who develops these, who's at higher risk, why they develop them, as well as to better characterize what post-COVID conditions look like and how they affect people. So identifying post-COVID conditions can be challenging. By definition, they develop after someone recovers from COVID-19 infection. So this can only be a diagnosis that's made 4 weeks after someone recovers from COVID-19. And the reason for that is if it's any sooner, it's going to be difficult to tell if the symptoms are still due to COVID-19 infection or if they're these kind of lingering effects that we see with post-COVID condition. At this time, there's no specific test to determine if someone has post-COVID conditions. The diagnosis is made somewhat as what we call a diagnosis of exclusion, where lots of things are ruled out. And then we kind of determine, okay, it seems like this person probably has post-COVID conditions based on their history, laboratory and results, and diagnostic tests, as well as a physical examination. One of the things that makes post-COVID conditions particularly difficult to identify and to manage is that they vary from person to person. And there's a wide variety of different symptoms that people may have, and different combinations of symptoms, and different problems, and they can last for a wide variety of different lengths of time. One thing that is usually found is that post-COVID conditions do tend to improve over time. However, the rate of that improvement is also highly variable. So because there are so many different potential systems, it's not possible to create a complete list of them. But on the next slide, I discuss some of the most common symptoms that we see in patients who have post-COVID conditions. So if we start on the left of the screen, one of the most common and problematic symptoms is tiredness or fatigue. It can often be very severe, that interferes with people's daily lives. Another characteristic of post-COVID conditions is symptoms that get worse after physical or mental effort. And this is called post-exertional malaise. So anytime that someone exerts themselves, so that can include physical exertion, if you have to carry your groceries a distance, if you have to run for the bus, that can trigger your symptoms to suddenly worsen. And in addition, this includes mental effort. So if you have to concentrate particularly hard on something, or if you've had a very challenging day emotionally, that can also trigger your symptoms to get much worse for a period of time. And depending on the person, it can take a while for them to kind of bounce back to their normal level. In addition, things like fever, difficulty breathing or shortness of breath is a big one. A rapidly beating or pounding heart, also known as heart palpitations, chest pain, and cough. Neurological symptoms are especially common in post-COVID conditions. So we know that COVID-19 infects a lot of different parts of the body. And we can see when people they contract COVID-19 and they lose their sense of taste and sense of smell, that COVID-19 affects our nerves, including the brain. And this can sometimes cause, the problems involved that we see in post-COVID conditions. So difficulty thinking or concentrating, it's sometimes referred to as brain fog. Dizziness or lightheadedness upon standing, as well as feelings of numbness or pins and needles, especially in the arms and legs. Of course, the changes in taste and smell, as well as headaches and problems sleeping, and in addition, depression and anxiety. Digestive symptoms, in addition, COVID-19 can affect the digestive tract. So things like diarrhea and stomach pain. And then also joint and muscle pain, changes in menstruation, including menstrual cycle, rashes, organ damage can also be involved, especially if someone had a particularly bad case of COVID that they developed this from, as well as chronic pain and blood clotting conditions. Blood clotting conditions, specifically things like developing DVT, that's a deep vein thrombosis, or PE, pulmonary embolism. So that's when you get clots in your legs or in your lungs. And those can be also very serious conditions on their own. So obviously post-COVID conditions are serious, and they can make life very difficult for people who have these conditions. And so in January 2021, post-COVID conditions were recognized as a condition that could cause a disability under the Americans with Disabilities Act, or the ADA. Post-COVID conditions aren't always considered disabling. However, the definitions that's used associated with the Americans with Disabilities Act is a person with long COVID has a disability if the person's condition or any of its symptoms is a physical or mental impairment that substantially limits one or more major life activities. And so the fact that it's recognized under the Americans with Disabilities Act means that people who have a disability due to post-COVID conditions, they're eligible for reasonable accommodations. And there are a number of examples here, but for instance, a child who has post-COVID conditions or a young person in school, they can have additional time on a test if they have difficulty concentrating, or modifying a procedure. So a customer who finds it very difficult to stand in line can sit down while they're waiting in line, or helping someone pump gas if their joint or muscle pain might prevent that. Or even, again, allowing someone to sit if when standing they get dizzy, or allow them to have a service animal that's trained to stabilize them, accompany them. So obviously negotiating, having your disability recognized and being able to qualify for accommodations can be intimidating. However, there are quite a few resources and quite a few specific departments that have a lot of information and a lot of help with these topics. The Office for Civil Rights, as part of the Department of Health and Human Services, has a number of pages, including if someone believes that their rights were violated. And then the Civil Rights Division of the Department of Justice also has similar pages, including a page to report. The CDC has a great page on post-COVID conditions, which also can help identify those symptoms. The Administration for Community Living has quite a few. And then there are some resources down here about what these would look like in an employment setting. So this would be really helpful for people who feel that their post-COVID conditions are severe enough and it's really impacting their daily life. Another aspect of post-COVID conditions is, of course, as I said earlier, this is new. It's a relatively uncommon condition, but it's also a condition that manifests with a lot of different unpredictable signs and symptoms. And as a result, it can present challenges beyond the symptoms themselves, especially when we're talking about receiving the appropriate care that people need. So it can be very challenging to diagnose. And that's mainly because the symptoms of post-COVID conditions aren't often easy to explain. And frequently, medical tests and diagnostics will be normal, especially for a lot of the neurological symptoms. So you may have a patient who feels very, very unwell, a person who feels very sick, but their blood work and x-rays or EKGs, all of that may be normal. And this can sometimes result in misunderstandings, a healthcare personnel who's misunderstanding what their patients are telling them. And obviously, this is very difficult for a patient who's already feeling very unwell and who's having these problems to get the diagnosis they need, and it can potentially delay care and delay access to appropriate treatment. However, because these problems exist, the CDC has created a number of resources to help patients talk to their doctors and help them prepare for medical appointments. And these resources are available in both English and Spanish. I do have them listed here. So obviously included links, there's going to be a lot of links from this point of the presentation on. But there's tips for preparing for your appointments and preparing to have this conversation. There's a checklist of different symptoms and different things that you want to bring up when talking to a provider. And then there's also information for after you have an appointment with your healthcare provider for these topics about things to do. And these are available, as I said, in both English and Spanish. In addition, specific care for post-COVID conditions is not necessarily provided everywhere. It tends to be concentrated at healthcare facilities with expertise, and these teams do tend to be what we call interdisciplinary, including a lot of different kinds of experts to help treat the wide variety of things that and symptoms that are involved. So as a result, I assembled a list of different programs and clinics. A lot of these do tend to be concentrated in the greater Chicagoland area, but not all of them. And then I also included links to web pages. I included phone numbers. In some cases, I included addresses where I could find those easily for the specific clinic. So Northwestern, University of Illinois Health, University of Chicago, Advocate Healthcare in Chicago, Rush University Medical Center, and then also Southern Illinois University School of Medicine all have these kinds of clinics. So does Edward Elmhurst Health. There is a clinic in Humboldt Park that specializes in post-COVID conditions. North Shore University Health System, the Shirley Ryan Ability Lab, and then Loyola Medicine. All have these kinds of conditions, all have these kinds of clinics. In addition, while I was researching this, I put in a lot of effort to find information about which of these programs and clinics would treat the under and uninsured and those on Medicaid, Medicare. Unfortunately, I did not have much luck finding out essentially what kind of coverage they accept. Furthermore, depending on someone's health coverage, many specialty clinics may require a referral, which is also a potential barrier to accessing care. So I worked with a number of my colleagues to essentially try and find out the best way that we could help someone navigate these. And so my recommendation would be for people who are either uninsured or underinsured or potentially on, Medicaid or or are having generally difficulty or may have difficulty paying for their care, to see a physician at a federally qualified health center. I included a link here to find federally qualified health centers, to find one by you. These physicians are going to be very experienced in finding care that will accept a variety of different health coverages and will provide care for people who are uninsured. And in addition, they would be able to write a referral to these kinds of programs for those who need them. So for people who are encounter a lot of barriers accessing care, that would be one way to find help navigating this. And so, in addition, I assembled all the resources that I've already shown you, as well as quite a few more. And that's essentially the list that's coming now. So these are all the clinics that we already talked about. These are the federal resources for those with post-COVID condition disabilities. These are the CDC resources for talking with your doctor about post-COVID conditions. And this list includes a number of different support and advocacy organizations that might be helpful to people who are struggling with post-COVID conditions. There are quite a few different ones. I know that Survivor Corps has an entire Spanish website. Many of these also have at least portions that are in Spanish. However, one of the big advantages of a few of these is that they do have message boards. They do have places where people can discuss their post-COVID conditions experience with one another. Of course, struggling with a difficult to explain diagnosis or a difficult to treat diagnosis can be extremely challenging in and of itself. And so having social support from not only one's family and friends, their kind of social support network, but also having people who can relate to and understand what they're going through can also be extremely helpful. And so that is my presentation. I'm going to stop sharing my screen and I'll take, if we have any time, I'll take questions now. I also wasn't looking. Okay, wow. And then, of course, one of the big points of assembling all of these was that you'll be provided them. Lumia will email them to you, and you'll have all of these links and everything. Hopefully, that can be helpful if you have anyone who you know or who could be helped by these resources.
Definitely. Thank you so much, Tom.
Mhm.
I cannot stress how much time Tom, time, effort, resources, brain power, for this collection of information to come together. So thank you so much, Tom. I really, really appreciate it. Does anybody have any questions?
I know it's kind of a lot of things, a lot of information.
Yeah. Does anybody find this information useful, or any thoughts of oh, I want to share this with, anybody else?
Hi. Yes, if I can comment.
Yeah.
So this is interesting because I manage some projects centered around IllNet Recover project, and we were just having this conversation with my all partners meeting, where we have community-based organizations that are pretty much trying to engage and do a lot of outreach for talking about long haul COVID. And so this is really resourceful. I thank you for the information. Today was my first time actually seeing that there were clinics that that actually deal with long COVID. Mm-hmm. And so I appreciate your list. And I will most certainly, when Lubia sends this out, share with our community-based organizations, because this is the conversation that they're having in the communities. Where do I go? Who can I talk to? And so I really appreciate your presentation, Tom.
Oh, I'm so glad that you were here and you were able to see it. That's wonderful. I really hope that this will be useful. And of course, It's a lot of these resources they've been developing for a while, but of course it's taken a while to recognize long COVID and for a lot of people to especially start putting a name to how they're feeling and the fact that they're not feeling the same as they were before they had COVID. And so it has been a process, but there are quite a few things now. I don't necessarily think it's enough. I think we're going to need more and to help people, but it's certainly a start, and it's exciting that there are also organizations in the community that are that are providing help to people.
For sure. Tom, as you were presenting, I would thought, it'd be great to get some of this information out on our social media platforms. And so I might connect with you again to see like what we can parse out, what information we can, share, and above all, the resources, right? I think that that's really the big jewel of this presentation is that there are resources out there, and there are advocacy organizations that you found that are wonderful and can really respond. So thank you so much.
Yeah, I'd love to work with you on some of that social media stuff. Yeah. However, we can kind of get this out to help people. Let's see.
Agreed.
Solutions to adequate patient care complications due to the difficulty of diagnosing post-COVID conditions. Yes, so I think that the primary solution, anytime we have a diagnostic problem, especially with something new, it often results from, first, there not being particularly a clear understanding of the disease itself sometimes. And then also, once we do establish a clear understanding of what X disease looks like, then it's trying to make sure that healthcare providers understand that they're aware of that, so that when they have a case in front of them, they're able to recognize it. Sometimes that can be very, very difficult, especially because it's not always easy to reach such a large group of people consistently. You're never going to be able to get absolutely every doctor, absolutely every nurse. And so that can be a major challenge. However, once there is a good understanding out there, it can definitely help accelerate the process to treatment. And one other thing that I do want to mention with treatment, and this is quite unfortunate at this time, there's no way to cure this. And so essentially, treatment is supportive. We want to, help support someone. So pain management, if they're having pain, but it's kind of treating the symptoms. Like I said, generally most people do improve over time and get better over time, but it's working so that essentially they can still live their lives during that process, as opposed to it truly being debilitating for them. And also that they don't, the part with the accommodations is that, so they're not missing out on being able to do things and being present in their lives. And so that's really important. So while we can't cure it, we can make things better. And I think that it's really important that people are aware of that.
Agreed. Yeah. That is definitely true. Thank you so much for that last piece of information. And again, for the sake of time, we're going to keep moving. But Tom, if it's okay with you, I'll share your contact information if folks have any more questions. And then, as always, all of this information is going to go in the post-meeting email. So thanks again, Tom. Really appreciate it.
Of course. Thank you, guys. Always a pleasure to present to the IDPH Community Ambassadors meeting.
Yeah, thanks so much. All righty, I'm going to pass it over to my colleague Megan, and she's the public health educator in our toxicology program, and she's going to talk about our fish advisories for Illinois. Megan, take it away.
Hi, everyone. Yes, thank you, Lubia. My name is Megan Zerwanka, and I am the public health educator, like Lubia stated. And so part of my job is to do some education and outreach and bring awareness to the fish advisory. So thank you, Lubia, for allowing us to be, well, me, I guess, be on today and bring awareness to our fish advisories. I do have a few poll questions I'm going to throw at you guys through Slido. So it may ask you to accept when it pops up. It also may not. We test ran it on Monday, and one of the 3 people it did ask. So if you could please accept that, I'm going to stop sharing just so I can share my screen and do the Slido without any issue. So fingers crossed that this runs smoothly. Let me get my screen pulled up. Okay. And then expand that. Okay, so I am starting the first poll question. It may take a hot second for that to pop up. And the first one is, are you aware of fish consumption advisories that have been issued for Illinois waters and where you can find them? So I will give you a few seconds to answer that.
And then just for reference, the Slido poll is in the chat option, or it's right below the chat option. It should have popped up on your screen to the right bottom. If Megan, is that where it's supposed to come up?
Yes, I think so. Thank you, Lubia.
Okay,
it looks differently for me. So we tried to do the test run like in person. So I was like looking over shoulders, and they were looking over my shoulder, so we could kind of tag team, see what it looked like on both ends.
Cool. Alrighty.
Okay, so I'm going to go ahead and close the voting on that, and then move on. So for the fish contaminants, these are man-made and natural contaminants, and they can build up in fish to levels that may be harmful to the human health, especially the more sensitive population. Water concentrations of the contaminants are low, but the contaminants are thousands of times higher in fish, which is where we would be primarily exposed. So one specific contaminant is methylmercury, and it is naturally present in Illinois soils, found in Illinois fish statewide due to contamination from industrial air pollution. And a health effect includes the neurological development in children. So that is that sensitive population that I just mentioned. Another is polychlorinated biphenyls, or PCBs, and this is also another man-made chemical found near industrial or populated areas, and the health effects include developmental effects in children and could cause cancer in children and adults. And then another one is chlordane. This is also a man-made chemical, specifically a pesticide. It was once used to kill termites, but was banned for all uses in the United States in 1988. And health effects include developmental defects. And one important note about chlordane is we are actually removing that off of our list for this current testing cycle. We've seen large decreases in chlordane trends over the years, and we currently only have 2 advisories, one in Lake Taylorville and one in Lake Decatur. So we're going to remove that because it is fairly costly to run the test for these contaminants. So then now we can make room for other contaminants that could potentially be present. And so then I'm going to launch a second poll question. Which populations are most sensitive to the neurological effects of methylmercury exposure? I'll give you guys some time to answer that. Okay, I'm going to close the voting. And so our fish consumption advisories, they are issued annually by IDPH. All rivers and larger streams are monitored once every 5 years, and public lakes are monitored every few years, with the exception of Lake Michigan. That is on our list every year. And the advisories were developed through the Fish Contaminant Monitoring Program, which is made up of the Illinois Department of Natural Resources, or IDNR, Illinois Department of Agriculture, or IDOA, Illinois Environmental Protection Agency, IEPA, and IDPH. The program was founded in the 1970s when they began testing fish for contaminants across the state of Illinois. So IDNR goes out and they collect the fish, IEPA runs the samples through the lab, and IDPH reviews the results to put out, remove, relax, or make a current advisory stricter. And so these are called site-specific advisories. And then here we do have our fish advisory QR code. So if you guys want to follow along, you can go ahead and scan that QR code and it will take you directly to our fish advisories homepage. And then you guys can kind of follow along with maybe your county or a body of water that you are most familiar with while I go through and do one that's more close to me. And if you do have your phone set to a different language, it will prompt you at the top to convert the web page to that language to make it easier accessible when you're kind of going through everything. So when scanning it, this is what it will take you to and what it will look like. This is our fish advisory homepage, and then you can click the little link right above our state picture, and then that will take you to our interactive fish advisory map, which displays the current fish advisories for the year. If you're on a computer, then you can hover over the county and it will tell you which one it is. But if you know what your county looks like, then you can click it. Or if you scroll down a bit, then there will be a drop box that says Illinois, and then you can select your county there. If you click your county and a water body doesn't pop up, then you'll see a little bit of text stating something along the lines of there not being a site-specific advisory for that county, but it will show our statewide methylmercury advisory, and I will touch base on that in a second. Okay, so I selected Sangamon County since that's the county I work out of. And we have the Sangamon River, Spring Creek, and the statewide methylmercury advisory, which states a statewide methylmercury advisory applies to all Illinois waters. IDPH recommends that women of childbearing age and children, which we are actually updating the language to not specifically state women, and I will kind of touch base on that later as well. And children limit their consumption of predatory fish, so bass, sauger, walleye, flathead, catfish, gar, muskie, northern pike, trout, and salmon to 1 meal per week, so still fairly generous. Unless a more restrictive advisory is in place, waters with site-specific advisories are listed below. If your water is not listed, follow the statewide methylmercury advisory. So let me launch the next one. What happens if your specific body of water isn't found on the interactive map? Okay, so I'm going to go ahead and close the voting. And so the correct in quotes would be I follow the state methylmercury advisory guidance. And then here I went into a little bit more detail by selecting a certain body of water, and I chose Spring Creek from the Sangamon County list. And so it will display the fish name, its picture, and the meal advice, and then the contaminant that was detected in the high enough levels to warrant the advisory be placed. For this, it is common carp, 1 meal per week for all sizes, and the contaminant of concern is PCBs. So if you were to click the PCBs link, then it will take you to our fact sheet. So then right here is where it would be. And so this is actually on that first page of our homepage. If you were to scroll all the way to the bottom, you will see all of our publications. And I actually do have our fish advisories for the year. So you'd be able to download the entire list. And as you can see, this has a new advisory. So bluegill, red ear, for Anna State Pond. And so we like to kind of highlight if things change just so you are a bit more aware. So then you can see the non-sensitive and the sensitive categories to follow, which I will touch base on what that means in a second. So for the sensitives, as I mentioned before, it said women of childbearing age, and we're not really using that language. So what we are currently using are those who are nursing, pregnant, or can become pregnant, and children under 15. And then the non-sensitives are those 15 years of age or older who cannot become pregnant or are not planning to become pregnant. And as I mentioned earlier, that the contaminants are most harmful to the sensitive population. So if you were to access the PDF version of it, then you can see the list of advisories with the 2 columns for the sensitive and non-sensitives. For PCBs and chlordane, the meal advice is the same for both populations. When the leading contaminant is methylmercury, then you would notice that the sensitive population has a more stringent meal advice. For example, the non-sensitives may have an unlimited for their meal advice, but sensitives may have 1 meal per week. And this is due to the fact that methylmercury harms the development of an infant in utero, but also once they are born, if the mother chooses to nurse, as the contaminant can be passed through breast milk. And then just the final follow-up question so we can test if you are now aware of the fish consumption advisories that have been issued for Illinois waters and where you can find them. Fingers crossed that it is all yeses and that I did a good enough job during this presentation for you all. And I do have my contact information as well as our general one for dph.talks. And so there are 4 of us who monitor that. So you can reach out to either one for more information or if you have questions. And then, like I showed you earlier, the little screen snip of our fact sheets, you can go through and download those. But I did also email some to Lubia if she would like to send those out to everyone. Just for easier access. So I'm going to go ahead and stop sharing my screen.
Thank you so much, Megan.
You are welcome.
I know that as I was, we've been working together to do stuff for the state fair and then learning just in our day-to-day work stuff, learning more about fish advisories. It's really interesting to see like, oh, there's a lot that we don't know in the everyday, right? I mean, if you're a fisher, if you're out there all the time, then that's one thing. But, I'm not super regularly on the in the lake, doing activities, but it's nice to know. And then, if I know somebody, then I can share that information with them. So thank you so much for sharing that information. And again, we'll be sharing out all of the materials that Megan sent me, so that you will have it as well, and then be able to access that and share the information. I think there's a comment. Great presentation. I was unaware that this information even existed. That's wonderful. Yay.
I also was unaware until I started this position. So
ditto. Yeah, ditto for me too. That's wonderful. Okay, well then we are a little over time. Thank you all for staying this late. I know that my colleagues are probably really exhausted and want to get home, and I know you all are too. I just have 2 more things for ambassadors. If those of you can stay on, that's great. Anyone who needs to drop off, that's okay. Remember, we have the recording for you all to take a look at, and you can listen to the final piece of this later on. So thanks again for all of those who have to hop off. For those who can stay, like I said, I have 2 things. One is that I wanted to share a social media campaign and just like a media campaign, some ads that we are running across the state. And this is regarding pediatric vaccination campaigns, right? So, during COVID, there was a lot of people, including parents, who kind of put vaccines off. We didn't have the same access to our clinics, to our doctors during COVID. And so we're trying to remind folks that, hey, like this is a good time to, take a look at the vaccinations for your kids, and then maybe also for yourself in case. But I wanted to show you an example of what they look like. And I see, Megan, that you've seen them. Yay. So this is one example. I think I've seen, let's see. These are some social media things that we're starting to run. So you might see them on our social medias coming up. And then I know that I don't think this is the right one. But anyway, this is the same, like you'll see some of these ads, some of these campaigns as you travel through the state. I think our one of my colleagues told me today that an ad came up on Spotify. So if you're in the geolocation that we've purchased some of these ads for, then you'll probably hear them or see these cute little videos with these super adorable kids. But again, the campaign is around reminding folks to get their vaccines, to get their kids checked up, and to just check in with their pediatricians about that. The other campaign that we have going on is around lead awareness. And that usually comes up every summer. We do some posts and some, ads and just information sharing about testing for lead. And so I will include some of that information as well in the post-meeting email. And then that way, like have that information and then be able to share that. And then finally, this portion kind of speaks to our ambassadors program. So there are, when we the last time we met was right before the end of the emergency public health declaration for COVID, and we gave information about what that means, what it looks like. But then also I have some questions from ambassadors about our program, right? Because a lot of us, including myself, I was an ambassador before I began working at IDPH. We joined because we wanted to be connected to IDPH. We wanted to know what the information was. As COVID was coming out, all of this new information, and we were like, what's going on? And so we signed up to be COVID ambassadors. And then when I started, we rebranded, right? We changed the name. We said, okay, well, there's a lot of, COVID's important, but then there's also, Mpox was going on, which at that time was called monkeypox. And then RSV came along, and then there was all these other issues that, keep coming up. And so I said, well, it's important for all of us to have the same information, right? And to have information about these emerging public health issues. And so I said, let's change the name. Let's say, okay, it's going to be our community ambassadors, and expand the program, bring more programs in and more information, and to keep it going. So, but that also means that there's some folks that are like, you know what, I just wanted to be a part of the COVID information sharing, or, there are people here who are like, yeah, I just, this is a great program, let's continue, right? So you'll be seeing some information in an email from me to just let me know if you wanted to continue being a part of the program. I know there's some new people here, and that's wonderful. And then, but this is for all of our ambassadors, right? If you want to keep being engaged with the program, I would love to have you, and we would love to continue being connected. But if your commitment has changed, and that's okay, I will be sending out, like I said, some information, some actions that you can take and then some information you can share about recruiting, right? We're still always recruiting and always welcoming new people who want to be connected to IDPH through this program. But, recognizing that there are changes in commitments and interests and time and things like that. So just wanted to put that out there for everybody as a thought. And then if you have questions about what that means or what that could look like, please let me know. One of the things that I did want to share is that I have on the line, I think still Aiden and someone from NEIU. So we've had conversations about, expanding the ambassadors program in colleges, including NEIU. And so that's the kind of engagement I want to see and I want to continue creating with this program. So if you have any ideas of that, of how to engage or other programs or other ways to make this program unique and special and worth the time, please let me know. Send me an email. Make some time. Let me know, and we can set some time apart. So, but yeah, I just wanted to let you all know that that's where the program is right now. I know that. Also, the weekly newsletter hasn't gone out. I just honestly haven't had the time to get that together, but that's going to come back pretty soon. It's probably going to come back at the end of August or the beginning of September. But it's going to look a little different. It's going to be more information, but less space, right? Because the last one was just like a long newsletter, and people were like, "That's a lot of information." So still taking, revamping, making sure that it's useful information, that it's things that you want to hear, but then also getting feedback from you all as well. So those are just some updates that I wanted to share regarding the program and what you can expect moving forward. Does anybody have any questions about the program or any of the things that I shared just now? Hearing none, that's okay. No worries. I'm always available via email, maybe a little delayed here and there just because I'm going to be working the state fair. So all of August, I'll be a little bit unavailable, but still responding to emails and still, willing to make time to chat about the ambassadors program. And with that, I will say thank you again for making time to be here today. And you will be getting all of this information in your inboxes tomorrow. And please reach out if you have any questions. Have a great rest of your evening, and I will talk to you all soon. Thanks.
Thank you. Take care.
Thanks, you too.
Thank you.